Hello, so today we're going to discuss mental health and goal setting. Have you ever set a goal, and I'm not talking about a New Year's resolution, I'm talking about set a goal like, I'm going to do this. I'm going to pass this CDL test, I'm going to pass this licensed mental health test, I'm going to go to the gym, I'm going to get an A in school, and then all of a sudden, these goals aren't attained. There were some elements that I had to learn along my educational journey, which was such as when I set a goal, was it realistic? Certain areas I wasn't really good at math, wasn't really interested in math, and kind of had a discomfort, a dislike for math. So later on in life, if I know a career is highly based around math, such as accountant, bookkeepers, astronauts with knowing physics and stuff, if I know that that's an area that I'm not really interested in, that's going to be difficult. So it has to be realistic. I can't now say, I want to do something that takes years of training and I know that it's just unrealistic. I'm like military. If I say, well, I want to be a sharpshooter, am I ready to do that? If I say, I want to go to the military and be a Navy SEAL, am I at the age of the qualification to do it? So your goals, such as even small goals, taking walks every day, they have to be realistic, measurable, and attainable. For a lot of clients I work with, I tell them to, keep a journal, even if it's just stickies every day. This is something that's going to help you measure your outcome on a daily basis to know where you're going. Point made. A partner of mine that saw me, giving educational and informational information daily, he said this to me. He said, Ulysses, you could kind of organize things that you say as in educational and clinical. So I have to sit and say, all right, well, you're a doctor, you have a PhD, you have a lot of friends, a lot of information coming, organize things. I have another friend that says associates. He said, Doc, keep going, keep doing what you're doing, and watch if you do this for 90 days, watch the results and the change. So now that's motivation for me. But is it measurable? Yes, because I could see that if I get online, do my regular 9 to 5, and drop some shorts every day on YouTube, Instagram, and Facebook, what's going to be the results? So I want to measure it on daily. What do I do? Is it attainable? Yes, because it's something within my reach, So now I know that it's measurable and attainable, and it's realistic, because it's not like I'm going somewhere with a big studio set up and I got to leave Long Island and go to Manhattan every day and I got to fight through traffic. So those are the things where we have to make sure our goals are realistic, measurable, and attainable. So when you set a goal, when you set a New Year's resolution, make sure that these 3 elements are there when you think about it. I know some people that's getting ready to take CDL tests. You got to study that book. They're getting ready to give you a big car to drive, tractor trailers to drive. You got to know that. For those that are in the social work and mental health field, that test is no joke. So for those that discuss mental health issues, do yourself a favor too. You go online and find it for free. Take a free practice test on mental health and read the vignettes. When it says a young lady could be going through this or that, is it post-traumatic stress, or is it anxiety, or is it depression, or is she having a panic disorder? You can guess as a normal civilian person, but us as licensed mental health practitioners, we have to know. So as you even going into the field of social work, mental health, make sure, is it realistic? Is it something your heart wants to do? And is it attainable? It's like getting my PhD, becoming a doctor. It was a lot of money and financial, stress that came with that. And I had to say, well, each semester was going to cost me X amount. Did I have that, or did I have access to that? So, that's how I became where I was at, because I had a pen and a paper and I had to write down and measure the classes and the goal, and was a roadmap to how was I going to accomplish each goal. And people that already had a doctor's degree were telling me, Ulysses, you're doing great. Don't stop. Don't give up. Keep focused. Keep going. So make sure your goals are measurable. And that measurable is writing it down every day, so you can look at your footsteps, how close you're getting or how you're not getting. So again, we're talking about, and how that plays on your mental health is that as you're going towards these goals, you can get very, very anxious. You know, I was anxious during the comprehensive examination. I was anxious against the license, you know, going up to get that licensed mental health test. Because guess how this anxiety can take a nosedive to depression. You fail the test. You don't get your license when you wanted it. So now, how is your mental health associated with those goals? You know, these are the things that we're going to talk about, you know. So let us know how you set goals and how you've been able to accomplish certain things, you know, and what roadmap do you use? Dr. Ulysses Jackson on goal setting. Thank you.